Okay, we'll go ahead and call the meeting to order. We're running a couple of minutes behind, but we'll get moving. Before we go into the budget, a couple of comments I'd like to make in general. First of all, I want to thank Chairman England for his work on this part of the budget, and also our folks over in the House Budget Office who worked really hard, and especially our budget analyst, Margie Coggins, who worked to help put all this together for us. And secondly, I want to thank the governor for his leadership and vision about trying to improve health care in this state. I think that this budget that we were given leaves us in much better position than we've been in the past. So I think it was easier for us to work from that than we've had in the past. And if you'll remember in the governor's State of the State, that he made a few points about health care in this state that I thought were really important in his health care initiatives. You remember he wanted to establish a world-class public university, medical university here in Georgia, and be one of the top 50 nationally. Also, he wanted within this the Georgia Health Sciences University to become the state's second National Cancer Institute designated cancer center, along with Emory's Winship out there. And thirdly, to establish 400 new residency slots in Georgia across the state. And I think we all would agree that if we have a Georgia student go into a Georgia medical school and they do a residency program in Georgia, the chances of them staying here in this state greatly increase. So with that in mind, I think that helped us as we worked through this budget with some of the recommendations that we wanted to make. And having said that, I'm going to start and we'll go through here and I'll be just discussing the differences. So the first one will be 17.1.2. This was provide one-time funds to evaluate a new reimbursement methodology for outpatient services. We are recommending a zero there. With the discussion that's going on with Navigant, we felt like it would be prudent to wait until we get further along with that. 17.1.3, provide funds for the federally mandated expansion of diagnosis and procedure codes for billing Medicaid. We changed that number, and you can see there, to $663,000. The reason for that is there's been delayed implementation on that, and we don't think that they will need that full amount to do that at this time. Next change, 17.1.5. This would provide funds to expand efforts to identify inappropriate and medically unnecessary service utilization. This is where there would be additional audits to audit the waivered services to try to make sure that they're appropriately used. And if you keep this in mind, when we move over to 17.5.6, you'll see that over there reflected. 17.2.6, this is provide funding for the AHECs to increase ongoing housing resources. This is $693,000 to expand housing support for medical students and other health professional students as they rotate through their clerkships around the state. 17.2.7 is a $500,000 add to provide 2 new starts for the FQ8Cs in Whitfield and Randolph County. That's the 2 that were on their list of the most ready to go, and they'll provide care for our uninsured and underinsured around the state once they get up and running with this seed money. 17.2.8, this is a small $35,000 add for the Southeastern Firefighters Burn Foundation in Augusta. This is where they provide support to the families who come up and visit the folks who are in the burn center there. They had more than 3,000 burn victims to come through the burn center annually from all over the country. 17.5.3, this increases the nursing home provider fee, and this would go up to the 2010 cost reports, and that's an increase there. It's using part of their provider fee to do that, and there's about $4 million of state money involved in making that happen. 17.5.6 reflects savings from increased efforts to identify inappropriate medically service. This is the one I mentioned earlier, 17.1.5, about auditing the waivered services. 17.5.9, this reflects the single-dose vial reimbursement in physicians' office settings. This is where Presently, community health doesn't reimburse for single-dose vial waste, thus forcing a lot of the patients to go to the hospital to receive these services, which really ends up costing more. This will be able to allow that to occur in the doctor's offices, and ultimately I believe it will be a savings we can associate with that later. 17.5.10, this provides funds for 50 independent care waiver program slots. Currently, there are 130 people on that waiting list. This would address 38% of those. 17.5.11 increases the federal funds to reflect the increase in specific immunization codes and evaluation and management codes to match the Medicare rates. You'll also see this in 17.6.10. This is federal dollars where they'll be reimbursing the Medicaid providers at the Medicare rate so that it will ensure, hopefully, that there'll be enough providers out there to give the folks who need this service access. Because of the low rates they're getting now, this will help to bring them up to a more reasonable rate. 17.6.9, showing $12.7 million. Each year, community health rolls over excess Medicaid funds to the next year. This just anticipates that number there of these funds. 17.6.10 is, like I mentioned earlier, about going from the provider rates from the Medicaid to the Medicare rate so that we'll have those out in the state providing these services to our people. 17.9.2 provides funds for an operational analyst position, some $47,000. This person in the Physician Workforce Board will work with the data to analyze the statistics about what the residents are doing, where they're going, what their residency programs are, and this sort of thing. 17.10.3, this is a $185,000 ad. This is for the new residency program matched to 6 first-year residents and 3 second-year residents at the Houston Medical Center in the DO program there. 17.10.4, this is an $853,000 ad to expand the residency slots around the state, working with the Southwest Georgia Consortium as well as Gwinnett Medical Center. These two programs together would create over 200 slots and would be moving along very quickly with that, and we felt like this was important. 17.11.1, we are restoring the 2% reduction to the Mercer University School of Medicine operating grant. 17.11.2 provides $800,000 to help restore the reductions that had taken place when they expanded their Savannah campus, and just recently in the last few weeks they announced that they'll be going into Columbus and establishing programs over there for their 3rd and 4th year medical students right away. So this is to help with that program. 17.12.1 is the House is recommending no to the moving of that $1.4 million to the that was in the original budget. This leaves this money here so they can continue to operate and not reduce the number of residency slots that they operate as well. And the next item, 17.12.2, restores the 2% reduction that was recommended to the Morehouse School there. 17.14.1, this restores the 2% cut that was would affected the undergraduate medical education to Mercer, Morehouse, and Emory for their residency capitation grants. On public health, 37.1.4, we are recommending restoring $69,000 to replace a youth development coordinator position that was eliminated when the TANF funds were cut. 37.8.3, this is a big number, the $2.2 million. This partially restores the TANF cuts that took place when the TANF money dried up, and this is a service that the health department is mandated to perform, such as to serve the newborns and children needing medical and developmental services screening. 37.11.1, this is a continuation of us restoring, as we did in the supplemental, $2.5 million. This is to the implementation of the new grant and aid formula that would have caused a loss to some of the states. The counties. This is to hold them harmless in that effect there. And then 37.12.1 is a $45,000 cut. That's just a 2% cut on the amended budget there. And that's the changes that are in the budget. Is there discussion? Questions? Yes, sir. Move to pass. Is there a second?
Second.
Have a second. Any other discussion? Hearing none, all those in favor say aye. Aye. Any opposed? Thank you.
Thank you, Mr. Chairman.